when kids cannot latch into mom breasts, and very often this problem related to short tongue frenulum, or it looks like a skin underneath your tongue, and if it's not short enough, so kid cannot get to proper position and it cannot latch to the breast, which creates problem with eating. It creates an eating disorder. Kids are always hungry. Another problem, lots of kids can say some sounds like S's or L or R, and it's again, it could be related to high frenulum attachment, so which is an issue. Parents bring kids to speech therapist and all of it, and it could be helped much easier just to release frenulum. And I'm not saying you don't have to see any specialist after like therapist, yes, but it makes life much easier and the results quite much faster. Frenulum, it's a part of the skin attached to lower lip, we call labial frenulum, or attached to part of the tongue underneath. So nobody can see it, but I'm going to show as much as I can. If you look at this, that part of the skin, you see kind of attachment, that's a lip frenulum. But when you look at the tongue frenulum, it's a little bit up. I'll try to show me. It's again, if it's attached properly, in a proper size and a place, so you can advance your tongue like this. And kids cannot do that if it's short, or they cannot reach even palate. They have to close mouth to reach palate. If a dentist trained on those procedures, dental office could be good help, especially those dental offices who are equipped with lasers, which creates a much less postoperative effect, and it's much easier to do surgery because it's basically bloodless surgery. So the effectiveness of treatment is much higher because of every time laser goes in the mouth, it only removes so little tissue. So be very careful, and especially area underneath the tongue, which is full of blood supply and nerve supply, we don't want to damage anything of it. I have a little friend, Tommy here, dog with the human teeth, quite nice open. If you explain the procedure, what we do for frenulum attachment, usually if it's baby, we hold in between on our lap. If it's actually more adult, like a few years old or older, usually sit in the chair like it's shown here. We take a laser handpiece, and we have special folder to keep tongue off, and we just using laser to detach tissue from the tongue, so it creates a very minimum bleeding. But at the same time, it's very important because we do a safe procedure. We do layer by layer. Every stroke about 5-10 microns, so we can't damage any blood or nerve supply as well. So a procedure takes 5-7 minutes. Instructions: 2 months, 2 weeks. We do exercises, and we give exercises, and usually kids react to it very quick. Sometimes even kids can pronunciate sounds like right after procedure much clearer than before.